This surge in COVID-19 hospitalizations is now impacting the entire medical system, and pediatric care is no exception. Hospitals all across the inland Northwest are treating an increasing number of children sick with COVID.
This comes as hospitals have also reported low bed capacity in their pediatric units. KREM 2's Ian Smay spoke with doctors in Moscow and Sandpoint earlier today and has more now about how this current surge is impacting their ability to provide care. Ian?
Mark Whitney, Gritman Medical Center in Moscow is currently operating under Contingency Standards of Care. That's one step below the crisis standards of care in place for the rest of the state of Idaho. But even though the situation may not be quite as severe in Moscow, they too are seeing an increasing number of children sick with COVID-19. With school back in session, it means kids are once again among their friends in the classroom. But for healthcare workers in Moscow, Idaho, it means the possibility of treating more and more children for COVID-19.
We saw very little spread within schools and daycares in the last year, but in the last 6 weeks, it's almost every day there's a new outbreak in town in a daycare or a school setting.
While children returned to the classroom in most Idaho school districts last year, the surge of the Delta variant is causing more of them to be sick this year. And while the majority of children sick with COVID may not need a hospital bed, the trend healthcare workers are seeing during this Delta surge is worrying.
Kids under 10 are experiencing about a 1% hospitalization rate who catch COVID, which is actually pretty high. Kids shouldn't get sick and get hospitalized from most viruses. So 1% of all children who catch COVID requiring hospital stay is a big thing. And then a third of those are requiring the ICU.
Up north at Bonner General Hospital, healthcare workers haven't had to deal with a surge in younger COVID-19 patients. But with school returning, healthcare workers at Bonner General are preparing for a possible influx of children sick with COVID. And for them, the worry is personal.
As far as medically, I think that we as a facility are as prepared as we can be. However, what I find to be especially difficult, I've got a 3-year-old and a 6-year-old. I'm not prepared for them to get sick.
Dr. Day says current projections show North Idaho will likely see increasing hospitalizations for another 4 to 6 weeks. Luckily for Gritman Medical, they haven't had trouble transferring pediatric patients to bigger regional hospitals, which has been the case for adult patients. Day says there's about 1 or 2 days a week where bigger hospitals warn they may not be able to take on pediatric transfers, but most of the time they can. Those at Bonner General also say they aren't having much trouble finding places for pediatric transfers. But with the current surge looking like it will last for weeks, they're calling on help from the community.
None of this is new. Wear masks, socially distance when possible. If at all possible, please get vaccinated.
I think we know that there is an end in sight, and we just have to keep looking toward that. But it would be really, really helpful if everyone would do their part by getting vaccinated.
Most of the COVID patients hospitals in North Idaho are treating are not fully vaccinated. And of course, many children still aren't even eligible for a vaccine. Also, both Gritman Medical Center and Bonner General Hospital said that while pediatric transfers are going smoothly for the most part, when it comes to adult emergency transfers, they are sometimes having to send people as far away as California and Nevada to get them the help they need. In the studio tonight, Ian Smay, KREM 2 News.